Another way I like to look at this is by discharge. And so if we look at your total allowances per discharge, then we can see we have data on the far left here that compares all hospitals that we are comparing here. And so one of the things that you will find is that there's a long list of hospitals, and we give you the hospital charges, the contractual allowances, and then the average bill or the average cost per discharge. And so you can literally go here. You can look at, let's say, New York. You can go to New York, look at all the hospitals, know what their total charges are on an aggregate level, what their contractual allowances are, and then their average bill per discharge. And so if you do this, for example, then you can understand that Memorial Hospital for Cancer has the highest cost per discharge or bill per discharge that the insurance company and patient will pay. Likewise, you have New York Downtown Hospital, that's the lowest at $10,000 per discharge. So it's quite interesting because then you can see the total charges, you can see their contractual allowances, and then you can see what the cost is on a discharge basis, which is really, really interesting. And then you can also highlight whatever hospital you want to highlight and see on the other end what your average billing amounts will be per discharge. And so you'll have your total charges, contractual allowances, and then your estimated bill. One of the things I find interesting with a lot of these hospitals is that they trend very closely, but sometimes they will look quite different. And so, for example, Bellevue Hospital Center, you have hospital charges that are high and you have low contractual allowances, which means that you're going to get a high estimated bill, which is out of the normal for sure for that hospital. But if you look at, let's say, a memorial, then you're going to get a trend where you have a trend up for hospital charges. You'll have contractual allowances that also trend as closely as possible. And then you will get the difference, which is an estimated bill. So I think this is quite interesting and quite telling in terms of how this works. At an aggregate level, if you have on average a hospital charge of 63,000, you will get a contractual allowance of 49,000. What this means is that your hospital bill will be $14,000, which is more palatable. And this is how contractual allowances work. You get a total charge, there's a contractual allowance that's negotiated, and then the total bill will either go to the patient and the insurance company will then be able to pay that amount. And so I encourage you again to look at this on a hospital level in order to understand what the numbers actually mean. Many people look at a bill and don't quite understand what they mean. They don't really look at CPT codes, or they don't really look at the amounts that are negotiated and how insurance companies negotiate that. But if you have questions about this and you understand how contractual allowances work, then as a patient and somebody who is using healthcare, you will be much more sophisticated than, let's say, 90% of the people who are using healthcare. Likewise, if you are within healthcare, then it is behoove you to understand how contractual allowances work and how they differ by hospital. And so if you are in a hospital, let's say that has high contractual allowances, then you can expect specific behavior from insurance companies and patients than if you have low contractual allowances. And so if you have high contractual allowances, then you will have, let's say, more aggressive negotiations than if you have low contractual allowances from the get-go. And a lot of this depends on the city and state and the kind of hospital or clinic that you are.